In normal day-to-day life, we tend to fall into one of two crowds, the live to work or the work to live kinds of people. When you're faced with a fight against cancer, your priorities tend to change. Being able to work becomes a sense of normalcy for some, while for others, it takes away from the time they have with their loved ones. There's no right or wrong way to look at this, but in this video, I'll walk you through 1, a list of important questions for you to ask your treatment team to make sure that your plan aligns with your goals, and 2, tips and strategies for continuing to work on your terms. This includes numbers to call and national organizations that can provide you some personal support in maintaining whatever work-life balance fits with your preferences. This is part 7 of a full series on cancer prehabilitation. You can watch these in any order, but in the early ones, I went through the general structure of a typical prehab program, how it can benefit you during cancer treatment, my plans of attack for different cancer types, as well as a discussion in the exercise, nutrition, sleep, pain, mood, all those pillars of cancer prehabilitation treatment. Swing back to those after we discuss the best strategies and resources to keep you active and working, plus a full list of questions you can ask your medical team to ensure prehab works for you.
My name is Dr. Alex Watson, and I get people ready. I'm a double board certified physician in physical medicine, rehabilitation, and obesity medicine. I take this expertise in metabolic and rehab medicine, and I help patients get ready for major medical procedures. In this series, I'm sharing my best insights for prehabilitation before cancer therapies. I'm also giving away the cancer prehab chapter of my book for free down below. My only minor request is that you give this video a thumbs up and subscribe so you can see when the next video in the series is released.
Okay, so in this section, I'm going to teach you different questions that you can ask your treatment team to broach the subject of prehabilitation, see where it applies, and how it might be beneficial here, because not everyone's going to be as up-to-date on prehabilitation as you will be now. All right, so for the first bucket of questions here, let's figure out what your prehab options are. So the first question you can ask would be something along the lines of, would a prehabilitation program be applicable in my type of cancer and my treatment plan? This will introduce the idea, kind of gently nudge them into considering this if they haven't already. Though at this point, I think that it should be a little more commonplace. So they shouldn't be looking at you like you have 3 heads. In this case, it might be that's a good point. I wonder how X, Y, and Z might be able to benefit your particular treatment plan. Next one would be something along the lines of, what specific functional improvements can I expect from integrating prehabilitation into my treatment plan? This one, you might want to bring some notes in terms of some of the benefits, some of the studies I pointed out earlier, and see where they think it might apply in your particular case. Related to that, how might prehab affect my outcome or my recovery timeline? They're not going to be able to give you specifics. They might even just say, it's too uncertain for me to say. But if they can at least kind of give you their insightful opinion in your particular case, this will at least give you the opportunity for kind of an end goal in mind, the carrot at the end while you're running on the treadmill trying to figure out how to get there kind of thing. And the last one, when the heck should we start? So what's the ideal time frame to begin prehab relative to the treatments? How soon can you start is a good way of kind of getting in there. Trying to make sure they've anticipated the timeline for prehab relative to your treatment program. Understand that prehab needs to be about 4 weeks to really have that maximum effect. And ideally giving you enough time for dedicated prehab while also not delaying treatment for too long, because that still makes everyone uneasy for good reasons here. And delaying treatment for prehab may not always be an option. So if your case does not allow for that, don't worry about missing out on some major thing. In this case, the treatment is going to be that much more important. Okay, the next series of questions are related to the actual program components and specifics. So what components of prehab might be beneficial for me, whether it be exercise, different nutritional targeting, psychological preparation, or combination? This kind of gets into the fact that they may not be thinking prehab as the term, but they'd be thinking about those prehab components already. So you don't want to seem like you're trying to backseat drive or undermine the care, but just inquire inquisitively here what they've got in mind and see if maybe some points we've discussed or other points in literature you can find in your own research review might be able to guide some treatments for optimal outcomes. The next one would be related to something I touched on earlier, but will insurance cover this kind of a treatment program? And then if not, then want to suggest that, hey, there may be a way to bill these to insurance without actually being for prehab specifically, but instead you're treating whether it be cancer-related fatigue or osteoarthritis or something else related to the condition, prehabs can target that, but maybe don't call it prehab for the sake of dealing with the insurance demons. So the next one would be, if you started a prehab program, or if you have one in mind, what happens when you start treatment? Do you continue the same exercises? Do you modify them at all? Often this is most applicable for anything related to intervention. So almost certainly going to have to modify your exercises once that happens. Say you get an axillary lymph node dissection or a tumor resection. Where does the plan change in relationship to that procedure? And then when can it change back, or when does it change again, along with the recovery timeline? And the last piece, where does prehab and the prehab team members, where does that all fit within the other or the typical pre-surgical or pre-treatment timeline? Is there a formal kind of program at this institution? Is there someone who might be able to be looped in here to guide some of the prehab preparation, things like that? And where will it fit? Next section will be safety and monitoring. So how can we make sure that this is as safe as possible? Basically, what warning signs should prompt me to reach out to you, medical oncologist, surgical oncologist, from the patient perspective? What are some concerning signs here that something related to prehab might be negatively worsening my health or worsening my potential outcomes for treatment? They'll be able to give you that kind of professional interpretation based on your current situation. How often is it necessary to reassess the program we built here? So, is it every couple of weeks you want to say, all right, let's see, do we need a exercise tweak, nutritional tweak? Are we evaluating kind of in real time? Do we have any sort of devices like a continuous glucose monitor if controlling blood sugar is a target here? Say you reach your glucose goals. Well, then it's like, okay, well, do we change the caloric makeup of our diet to maximize muscle mass maintenance then? How does this change? That goes to the next question here. Are there any sort of specific measurements or tests to track progress, know that we're reaching our goals, or need to change our strategy at all? That's really important for setting goals, just to be able to know when you're on track and reevaluate periodically, but not too frequently where all you're doing is constantly rearranging chairs, but not actually really getting anywhere here. And lastly, how should you be communicating your prehab activities with the entire cancer care team? Do you go through one point person like a social worker or medical oncologist? Do you individually tell everyone based on whatever you're doing that relates to their specialty? How is this communication bidirectional and can be streamlined as best as possible? Okay. Moving on, let's talk about how to maintain a work-life balance if you want to continue working during treatment. So not everyone is going to want to continue working. That is understandable. This is a very personal decision. But if you want to continue working, it is a way of kind of maintaining a little bit of normalcy feeling if that's what you want to do. There's no right or wrong answer here. So don't feel wrong if you're like, I can't focus on work. Should I be focusing on work? No. This is only if you want to try and maintain kind of a business as usual feeling in your day-to-day. First, you want to have different workplace accommodations. You got to know your rights. So doing a little bit of a dive into the Americans with Disabilities Act or the Family Medical Leave Act. You can use any of our wonderful new AI friends here to help break those down for you and put in context with your particular situation. Discuss options with HR about working from home, reduced hours, flexible start and end times, how they can accommodate all your treatments and things like that. What modified duties might be appropriate here. Maybe some physically demanding tasks are no longer going to be feasible here. How can you offload those to the right person and then have the opportunity to take them back once you're ready and able if you'd like to? One strategy you can take in terms of treatments is, given the option, maybe schedule treatments before a weekend so that you have the weekend to recover. And this way, if you really do want to maintain a normal work-life balance here, Monday morning, you're a little bit refreshed after having the weekend to recover from a treatment of some kind. Or end of the day. If it's at least of the days, maybe all of your treatments that are going to occur on a weekday are going to occur at 4 p.m. And this way you have the morning to work, and you have that night and maybe the next day to recover. And then, day and a half later, all of a sudden you're back kind of at your prior baseline and can go back to work if you'd like. Kind of one sub-strategy here is managing your energy. So because of all the involved energy demands on when it comes to chemotherapy or during treatments or recovery from radiation and prehab and all that stuff. How can you maintain a high enough level of physical and kind of mental energy to be able to do your job? So you want to have maybe a little budget here, track your energy kind of peaks and valleys throughout the day. And if there's a pattern to it, as I alluded to earlier, structure your duties based on when your energy is at its highest. I mean, you can really focus the most and give it your best kind of efforts. Take strategic breaks. I mean, even in general, it's good to work intensely for 20 or 30 minutes, then take a 5-minute break, let the brain recharge a little bit, rebuild some of that, chemical energy in the brain, and then get back at it. Trying to plug along for long durations of time without any sort of refresher is going to give you diminishing returns in terms of your productivity. So even in normal context, let alone the context of cancer therapies, it's good to have that kind of strategic breaks, know when you're going to do them. So in between those, you're able to focus a little harder, knowing that you got a little bit of time to breathe coming up in a few minutes. Otherwise, delegate as much as you can. So give away any tasks that just aren't worth your time, or you just can't perform at your best and you'd like someone else to take over. Find someone who can be your point person for the delegations and give it to them to hold on to for a little while. Now, how are you going to communicate your current situation and your future with your employer? Find the right person. You want to decide which information you're comfortable sharing, and then find that one person with whom you are comfortable sharing that information. No one needs to know everything. Everyone doesn't need to know anything. Find the right combination of who's worth telling, why, and how much you really need to share with them. This definitely goes into potentially discussing things with, an occupational law kind of person, just to make sure that you don't accidentally put yourself in a tough spot if your employer is not being accommodating. Be realistic. So expectation management for yourself and for others. Don't overpromise in terms of your contribution if you're not really sure if you'll be up for it at certain times, because people will be supportive, but at the same time, don't count on them being 100% supportive. Factor in just that they have their own, without any sort of malice, they have their own deadlines, priorities, and concerns. And if they mentally prepare for a contribution from you and you aren't able to do it because of the obvious and very reasonable reasons not to, they may lose their supportiveness if there's something backed into a corner in terms of their work-life balance. If they can plan better for it, that's just going to be the best opportunity to get ongoing support from the team. So to recap that part, just set reasonable expectations for yourself and for others, and then don't overpromise. And use different technologies. We have tons of technologies to reduce burden in terms of calendar blocking, reminders, project management apps, because attention and concentration is going to be affected here. Chemo brain is a real thing, as well as just trying to manage your schedule. And so don't double book your time. All that's going to do is add stress, and employ technology where you can. And then how can you take care of yourself at work? Make sure that if you're going to be continuing to work, you are well supported and can give it your best, reduce burden on yourself, and just not burn yourself out in the process. So make sure that you have your medications, water, snacks, any sort of comfort items nice and accessible. Set up a little self-care drawer or something where I'll kind of have this for myself, just a little drawer full of snacks and things that you can grab in a pinch. Next piece, besides your comfort drawer, find a comforting place where you can rest if you need to. So sometimes employers might have kind of a rest and recovery room. I know we had this when I was a resident. There was a kind of retreat room that had waterfall sounds, actually waterfall in it. Nice lighting, comfy couch, massage chairs, that kind of stuff. Your employer may be very supportive with this, or you may need to get a little creative in terms of doing something at home in a work from home environment instead. And then be proactive about what items you have to manage symptoms. So back to scheduling things during high energy periods, make sure that you're leaning towards that in terms of blocking time, and then saving less important tasks for less certain times of energy. Use those technologies for written notes, reminders, scheduling, those sorts of things. When it comes to symptoms like nausea, have nausea medications handy, as well as have kind of bland snacks available in case you just need something to settle your stomach a little bit. Keep that in your comfort drawer. And as far as pain goes, manage pain proactively, it's a lot easier to prevent it or mitigate a little bit ahead of time than to try and chase it afterwards. So if that means scheduling Tylenol throughout the day, scheduling ibuprofen or NSAIDs as appropriate, whatever it might be, stay ahead of those things. And then also, if you're using stronger pain medications that may be giving you some sort of fatiguing side effects, similarly as the energy side of things, block your time appropriately, know when you may need a medication like that, and then think ahead in terms of timing with those.
Thank you sincerely for hanging with me through all those details. Again, please like and subscribe so others can find this resource during their cancer journey. If not already, the next video should be up within a week, and that one will be covering cancer survivorship and moving forward.